The following segment is sponsored by Oakview Medical Associates.
March is Deep Vein Thrombosis Awareness Month. So what does that mean, and are you at risk? Dr. Nita Bajour is here from Oakview Medical Associates this morning. Hi, Dr. Nita.
Hi, Margaret.
Deep vein thrombosis is a blood clot that starts in a vein and could lead to pulmonary embolism. So give us an overview of what we should understand about all that.
Yeah, so deep vein thrombosis is when you develop a clot usually in the deep veins, which are in the lower legs. And that clot can sometimes break loose and it can travel up the vein system. The main vein system is called the inferior vena cava, and then it can travel up through the heart into the lung circulation called the pulmonary artery. So deep vein thrombosis can lead to a pulmonary embolism, which can be very life-threatening and a deadly situation. So it's a very important medical condition to know about.
Well, let's talk about the symptoms now and what to look for and how should we react, Dr. Nita?
Yeah, so the symptoms to look for are if you develop a pain in your legs or warmth in a certain part of the legs. The deep vein usually goes through the calf system. So in that area, if you have a lot of pain, soreness, warmth, redness, and just a hot sensation at the back, do check with your primary care physician because that could be a sign of a deep vein thrombosis.
Excellent. And finally, there are some lifestyle choices I know you can make for prevention. So what are your recommendations there?
Factors that can lead to deep vein thrombosis are definitely obesity. When you're excess body weight, that can cause you to have more loose veins that can collect the blood in the lower circulation due to gravity, and that can pool there, which can then form a clot. You can also have patients that are hospitalized or bedridden, homebound, don't move as much, so they don't exercise the vein system to move the blood back to the heart. Certain medications like birth control pills is a big one. I've picked up quite a few patients in my practice over the years that have developed a deep vein thrombosis. You least thought about it. Smoking is another big risk factor. Hormone replacement therapy is another big one. Certain cancers, pregnancy itself can increase your risk. So when we look at lifestyle conditions, we can improve, get up and get moving, drinking a lot of water, improving your circulation. Also, if you're planning on a big car trip or a plane ride, then make sure you get up and move to keep your calf pump circulation going so you don't tend to pool the blood in the lower leg circulation, which can predispose to a clot. So there are a lot of things that can be done on the prevention side as well.
Right. And you can work with people on all those lifestyle choices, really help guide them toward a healthier life in general. Talk to us about your practice at Oakview Medical Associates and what makes it so special.
So our practice, Oakview Medical Associates, is a primary care practice in the Five Forks area of Simpsonville, and we've been around since 2008. I developed this practice mainly with the principle of personalized care, personalized attention to each patient. So we also offer urgent care, same-day appointments for our patients. We right now are doing COVID testing, taking care of all of our sick patients, but we also do wellness visits, annual physicals. We screen based on your risk. We have radiology in the office, ultrasound. We do all the cardiovascular testing, a lot of skincare exams. We also have added aesthetics, weight loss medicine. So we're trying to really give you the best medical home for your needs. We also work very closely with specialists. So if you have to see a cardiologist or a pulmonologist, we work very closely with them and we get you the best care that you deserve.
Excellent. Well, your patients really love working with you. They want to get in contact with you. Oakview Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville. The number on screen, 627-0444. Dr. Nita from Oakview Medical Associates, thanks so much for being here.